Administration announced a deal with the makers of these drugs to cut consumer prices and copayments. Let's talk now about what these prescription medicines do and whether they'll become more accessible with Dr. Jorge Moreno. He's an obesity specialist at Yale Medicine. Dr. Moreno, welcome.
Hi, Scott. Thank you so much for having me.
I want to get to the White House announcement, but first, how do you think and talk about what obesity is?
Yeah, absolutely. It's an important question. I'm glad we're talking about it. The obesity is a chronic disease, and I think there's still a lot of stigma and bias in social media and everyday interactions with patients with obesity. And, the old mantra, eat less and move more, is really antiquated. And I really think of it as a complex disease. There's a lot of complex hormonal signals that are really affecting patients' inability to lose weight. And it's beyond just willpower. It has a lot to do with the biology that really prevents losing weight.
According to the White House, many of them are over $1,000 a month, and the administration has announced this deal with drug makers to bring the price down to $350 a month for people who pay directly, and for Medicare recipients, their copayment will be $50 a month. A lot of questions on the timing, etc., but what is your initial reaction to this?
Well, I think this is very welcome news. I think it's very exciting news. One of the biggest hurdles in my clinic with caring for patients with obesity is I have conversations and messages about them losing coverage for GLP1s and not having coverage at all. And these medications have been shown in the medical literature to really have a decrease not only in obesity and management of obesity and diabetes, but they've been shown to have some great reductions in cardiovascular risk. They're the first treatment for obstructive sleep apnea. They can decrease progression of chronic kidney disease. So they're extremely efficacious and also safe.
Yeah. So this effort to push down these prices to, the range of $350 or so for people who buy direct, according to the White House, from Trump RX, is this a huge change? I've seen some drug companies already have big discounts and read that more market competition may be coming anyway.
Lilly Direct and Novo Cares, which are direct-to-consumer options, would already have the pricing for the lowest dose around $350 per month. For higher doses, it could go up to $500 per month. I think the biggest change is the copay for Medicare participants of $50 a month. Right now, Medicare does not have a exact criteria for covering these medications. And once the final criteria come out from this new initiative, we will have more answers.